Hi everyone, and welcome to the Healing Voices. I'm Nora, joined by my amazing co-healers, Cherise, Fatima, and Zubaida. Today we're exploring an essential topic in nursing, optimizing pain management in cancer care. Research shows non-pharmacological interventions are transforming how we manage pain and psychological distress. Did you know distress has been proposed as the sixth vital sign in cancer care? According to Paley and their team, organizations like the International Psycho-Oncology Society and AMA emphasize screening and treating distress as a core part of care plans. Ruano and colleagues also highlight that pain, one of the most feared cancer symptoms, is often underassessed and poorly managed, even though effective treatments exist. They stress the importance of going beyond medications to include non-pharmacological and complementary therapies, which can significantly improve patients' well-being and quality of life. With that being said, let's dive in.
As nurses, we are obligated to provide care that is tailored, effective, and backed by science. Nurses use the best research to guide patient care while considering individual needs. They assess pain, administer medications for severe pain, and integrate additional treatments such as radiotherapy or non-pharmacological approaches when appropriate. Using the correct strength of opioids depends on considering all these factors such as nociceptors, the reactions that come with using opioids. Nurses continuously reassess pain and adjust care plans based on evidence and evaluation. Opioids are not the only option. A multimodal approach to pain is also imperative to positive patient outcomes. For example, research has shown that integrative medicine also involves non-pharmacological therapies, which may reinforce the other therapeutic strategies. As the mind is used to improve physical function and health, using relaxation techniques not only reduces pain but also improves recovery outcomes. This aligns with evidence because it applies scientific findings to practical care when considering what works best for the patient. This is in reference to a practice review, evidence-based and effective management of pain in patients with advanced care article by Emma J. Chapman. The techniques we use is supported by research and improves outcomes by ensuring that pain management interventions are grounded in the best available research, which leads to more effective and targeted treatments.
Exactly, Fatima. Now, what specific interventions can we use? According to a systematic review and meta-analysis by Ruano et al., an effective psychological intervention for pain reduction in cancer patients is progressive muscle relaxation, or PMR, combined with guided imagery. PMR is a guided systematic tightening and relaxation of the body muscle groups combined with breathing exercises to release unnecessary tension. These techniques are shown to reduce pain, offering patients a self-care strategy to regain control over their symptoms. The review found that guided imagery, imagining a soothing picture, activates part of the brain that is involved in relaxation and pain relief. Now, let's talk about psychological distress. One standout finding from the review was the effectiveness of music therapy. It actually helped reduce depression and gave patients a sense of hope. So, pain and distress aren't just medical issues, they're emotional and social ones too. We create care plans that address the whole person, not just the symptoms.
Thanks, Char. So how does this all translate into clinical placement? In our clinical placement, we've seen how these non-pharmacological strategies are actively used. For example, I worked with a post-op patient who was admitted for surgery, but was in significant discomfort due to their newly diagnosed palliative cancer. They were visibly anxious over the increasing amount of pain they were feeling. After repositioning and guiding them through deep breathing exercises, they were seen to visibly calm, de-escalating the situation while a nurse was able to prepare their pharmacological pain interventions. In re-evaluation, the patient expressed they had felt a sense of overwhelm, which was lessened through the use of relaxation techniques. Incorporating these techniques were significant as in between pharmacological doses, pain or psychological distress may still persist, showing the necessity of multimodal approach. Nurses are also using tools like pain scales to assess which intervention works best for each patient, ensuring the most appropriate intervention for the patient. What's great is that these methods empower patients by involving them in their own pain management, as well as creating a calming and emotionally supportive environment.
To wrap up, non-pharmacological interventions are transforming pain management in nursing. Research shows they're effective, accessible, and aligned with evidence-based practice. These methods don't just manage pain, they improve recovery and empower patients.
Exactly, Char. We hope this discussion inspires other nursing students and professionals to explore the power of research-backed, non-pharmacological care. Thanks for listening, and remember, every small action counts when it comes to improving patient outcomes.
Well, there you have it, folks. Tune in next week for more insights and conversations.